Cosmetic Surgery and Laser Center of El Paso. This young female comes in, desires to have a little bit fuller cheekbones. So we're going to do a filler specifically in this area just to make the cheekbones a little higher, give a little bit more definition of the face. So the filler that we're going to use is one called Radius, and so that will go in here. So the way that I do it, I'm going to clean off the skin, I'm going to mark, and I'm going to inject a little bit of local anesthesia, and then the filler, we'll place the filler after that. So we'll get started and I'll show you some of the key steps. So I always go ahead and mark beforehand so that when the patient lays back, I know what I wanted to inject, because it changes when the patient's sitting up as opposed to lying back. So I always like to mark, and then that way I don't have to worry about the position she's in, comfortable position she's in afterwards. So this is the area that we're going to augment. So it'll be this area right here to give, basically just to give a fuller cheekbone, so to speak. So from here, I'm going to put a little bit of local anesthesia, and then we'll start with the actual filler. So this is the local anesthesia. So we're going to just inject just a little bit, and that helps out with the overall discomfort when we're doing the actual filler. So you can just see a really small amount goes in. You don't want to put so much that it's going to pop the tissue up, and then you're not sure what's being filled by the filler and what's being filled by the local anesthesia. Just a little bit, just enough to cut down on the discomfort, and then we'll do the actual filler itself. Okay, so this is the filler. Again, the one that we chose to use is called Radius. It's one I've used for many years, and this is a cannula on it. So it's, instead of a sharp tip needle, it's more of a blunt tip type of object. So it tends to cause less bruising. So I tend to like to use this a little more. So that goes in, and it's nice and long, so I can usually reach everything with one incision, well, not an incision, but a stick or a penetration site. So being filled as I go, and I'm putting just a small amounts in as we're passing back and forth of the tissue. So it's kind of a fanning motion. You don't ever want to put too much in one area. So as I'm passing through tissue, we're placing some. And I'll continue on with this process, and I'll show you when I'm done here. We've finished with the left side of the face. So here you can see the filler is in here, and you can see the difference when you compare it to this side. So all we need to do now is place the rest of the filler on the right side of the face, and we'll be done. Okay, so we're all done. Both sides have been injected, so you can see it's a pretty simple process. We do it right here in the office. A little bit of local makes it very comfortable for the patient. So both sides of the cheek a little bit fuller. Usually with that cannula, it cuts down significantly on bruising. It doesn't look like there'll be any type of bruise. So she'll keep some ice on it, and that's the process. I'm Dr. Mark Jaber with Cosmetic Surgery and Laser Center of El Paso. Thank you for watching.